TFM 95.4.
Let's talk.
Live on TFM and the TFM Facebook page. This is the live feed of TTV. Let's talk.
Hello and welcome to the Midday Update. These are the top headlines from our newsroom today. Over 300 flights cancelled in Oman's week-long ban. NCSI carrying out opinion poll on COVID-19 vaccine. Health insurance for private sector employees discussed. Kuwait to launch COVID-19 vaccination campaign today. India's COVID-19 recovery rate improves to 95.68%. Oman sails 49er teams resume training for Olympic qualifiers. Qatar to host FIFA Club World Cup 2020 across 3 venues. These were the top headlines of the day. Let's see how the weather condition looks like in the Sultanate in our weather update.
I'm Antra Bose with your daily dose of weather, and we're reporting from the TFM studio in Al Quair. Did you know that only 2 vestiges of ice remain from our planet's last ice age, the Greenland ice sheet and the Antarctic ice sheet? The latter is staggering in size. Clocking in at about 5.4 million square miles, it's almost the size of US and Mexico combined. That was our fact for today. Now let's step inside the studio and we'll talk a little bit more about weather. According to Oman Meteorology and Civil Aviation Authority, visibility will be poor in case of fog. Apart from this, the rest of the Sultanate will see mainly clear skies with the possibility of isolated clouds over certain areas. There are also chances of late night to early morning low-level clouds or fog patches over the Al-Wusta Governorate. With that, let's take a look at what the weather will be like throughout the Sultanate. Muscat will be sunny with temperatures between 25 degrees Celsius and 18 degrees Celsius. Musandam will be sunny with temperatures between 23 and 17 degrees Celsius. North Al-Batana will be sunny with temperatures between 24 and 16 degrees Celsius. And South Al-Batana will also be sunny with temperatures between 24 and 16 degrees Celsius. Al-Buremi will be sunny with temperatures between 24 and 15 degrees Celsius. Al-Dahira will be sunny with temperatures between 25 and 15 degrees Celsius. Al-Dakhla will be sunny with temperatures between 24 and 16 degrees Celsius. North Al-Sharqiya will be sunny with temperatures between 26 and 16 degrees Celsius. And South Al-Sharqiya will also be sunny with temperatures between 25 and 17 degrees Celsius. Al-Wusta will be sunny with temperatures between 26 and 18 degrees Celsius. And Dhofar will also be sunny with temperatures between 23 and 12 degrees Celsius.
Welcome back to TTV. You're watching Midday Update. Now, before we get into the local stories for the day, let's go straight to the COVID-19 update. The Ministry of Health has registered no death cases due to coronavirus in the Sultanate today, which means the total death cases remain at 1,491. In addition to that, the Ministry of Health has registered 54 new coronavirus cases in the Sultanate today. The total cases in the country have now touched 128,290, including 120,441 recoveries and 1,491 deaths, according to the Ministry of Health. In the past 24 hours, 263 recoveries were also reported. The ministry has urged everyone to adhere to social distancing instructions issued by the Supreme Committee and the Ministry of Health. Now from a local desk. If you all remember, yesterday we spoke about the first laparoscopic VVF repair in the Sultanate done on 2 females at the Royal Hospital from the Department of Obstetrics and Gynaecology. To get to know more in detail about this repair, we have Dr. Faiza joining us, who is the Consultant Obstetrics and Gynaecology and Urogynecology Specialist at the Royal Hospital. Thank you so much, Dr. Faiza, for joining us. I think, Dr. Faiza, we just lost connection with Dr. Faiza. We'll continue with the local stories for the day. More than 300 flights to and from Oman have been cancelled owing to the decision to close the country's borders for a week to stop the spread of new COVID-19 strain. The decision, which was made by the Supreme Committee to deal with COVID-19, was announced on Monday, December 21st, and came into effect at 1 a.m. the next day. The decision to prevent entry and exit to and from the Sultanate from the ports of entry on land, sea, and air for a period of 7 days has led to 148 incoming passenger flights being cancelled, as well as another 159 departure flights, said an official statement by Oman airports. They also continued saying that the total number of flights cancelled, therefore, stands at 307. Although international flights have been cancelled, domestic flights operating inside the country continue to operate. Cargo planes, goods trucks, and freight ships are also allowed access to Oman's ports of entry and exit. I think we have got Dr. Faiza again on call with us. Let's welcome her to the show. Thank you so much, Dr. Faiza, for joining us today.
Thank you.
First of all, congratulations to you and your team on this first VVF repair that is being done in the Sultanate. Could you please tell our viewers what exactly is VVF?
Yes. VVF is vitreovaginal fistula, which is a connection, an abnormal connection between the bladder and the vagina, which leads to the leakage of urine through the vagina.
So, Dr. Faiza, in terms of VVF, we know that it was done the first time in the Sultanate. Now, with this first laparoscopic VVF repair, what strides of achievements have been made?
So the repair of the vitreovaginal fistula has been done before in Oman, but open, which is more more traumatic. The procedure takes longer. But now the laparoscopic approach is easier. The incision is small. The opening of the wound is small. So the patient post-operative pain is less. She requires less pain management, and she mobilizes earlier after the procedure. Plus, the laparoscopic allows magnification of the field. So it's easier to see and more clearer to dissect between tissues because it's very difficult to dissect the bladder in these cases, because most of the cases of the vitreovaginal fistulas have been after previous surgery, whether it is for cancer indication or it is for a benign reason. So the vagina becomes adherent to the bladder. And to dissect that with using the laparoscope, it's much easier.
Dr. Faiza, you just mentioned that this procedure has been done before, but that was an open one, and this is a new technology in an advanced
and
way.
it is not like many of the procedures has been done in Oman,
Right.
because the specialty was not actually available.
Right.
So the specialty is a Urogynecology specialty. In the Royal Hospital was not there before 2020.
Okay, so this is something new that has been introduced?
Yes, we have Dr. Lamia Al-Kharoufi in SUH in Sultan Qaboos University Hospital as the first urogynecologist in Oman. And I'm the second one. And I'm the only one in the government hospitals. I'm the first one in Royal Hospital.
Right. Dr. Faiza, you also mentioned about that, now it's a new technique. Could you please tell us the length of this procedure? Like how much was it before and how long is it now? And in terms of recovery for the patient too?
So it's a faster recovery because the incision, as I said, is a very small incision. The procedure, the laparoscopic procedure, it takes around 1 hour. Whereas the open procedure takes a little longer than that. It might take up to 2 hours.
Right. And after 1 hour, once you say the procedure is done, is the patient, like you said, the recovery is faster?
So the next day they can go home.
Okay, that's what I wanted to ask.
Yes, the next day they go home. Whereas in the open, they would stay for 3-4 days after the surgery.
So with this kind of procedure taking first place in the Sultanate, what kind of achievements or modifications do you think it will bring to the society?
So it's the laparoscopic approach, is the standard now for all the subspecialties, whether surgical or gynecology. So advancing in the laparoscopic is still something which we need to achieve. Specifically in the clinic and the service we started now, we didn't have that much of treatment and care for the women who have just urinary incontinence, or they have urinary incontinence, or they have a prolapse. So the new achievement is that what we are trying to achieve is that we solve these problems. We bring attention to the public that the solution and the treatment is available in Oman. And there are new modalities of treatment which is now available also in the Royal Hospital for such cases.
Right. And Dr. Faiza, you said it's just you and Dr. Lamia that is in SQH who's into urogynecology.
Yes.
With a lot of people now enrolled in medicine, would you encourage the new generation to actually go towards urogynecology?
I actually encourage the new generation to go into obstetrics and gynecology and to subspecialize in urogyne and endoscopy and laparoscopic procedures. We have more of obstetricians rather than gynecologists.
Right. And Dr. Faiza, how is this VVF repair that we just mentioned happened for the first time in the Sultanate? How do you think it's going to help in the future?
It actually opens, it brings the attention to the situation we're having now, and to the rarity of such skills and such a procedure. It's worldwide. This is it's done regularly. We don't have such procedures being done regularly here, so we need to have more expertise in this field.
Right.
And we have to do them more frequently, so that we also get trained more and more. Even if you know how to do it, you need to practice it. You need to continue doing it.
As we all know, that practice makes the men perfect. And talking about these training and procedures, I just wanted to ask Dr. Faiza, what exactly is the future of OBGYN in the country? With the new advancement coming in, how do you see it?
It's a bright future. We have newer doctors every day. Every year, there are new graduates from the Oman Medical Specialty Board. And we hope they bring the better future with them, and they specialize in the difficult and rare subspecialties, so that we cover and we take care of the women in Oman.
Thank you so much, Dr. Faiza. It was a pleasure having you on the show and to get to know about the first VVF repair that has been done in the Sultanate, that too at Royal Hospital. Thank you once again for joining us today.
It's the first laparoscopic VVF.
Yes, laparoscopic.
Just to be specific.
Yes, absolutely. Thank you so much, Dr.
Thank you very
Faiza.
much for having me.
It was a pleasure. Thank you.
Thank you. Bye.
Continuing with our local stories for the day. The National Center for Statistics and Information in the country, in cooperation with the Directorate General for Disease Surveillance and Control at the Ministry of Health, continues carrying out an opinion poll during December 15 to 31st, 2020, on a sample of 3,000 Omani and non-Omani 18 years and over in all parts of the Sultanate. The survey poll aims to measure public awareness on COVID-19 vaccine, as well as the attitudes and practices related to the vaccine. The poll also aims to identify the surveyed individuals' view on the safety of the vaccine, their belief on its capability to prevent them from the infection, their opinion on whether it is necessary to take the vaccine for those with a history of infection, the side effects of the vaccine, and number of doses needed. The surveyed people will be also asked about their anxiety regarding the vaccine, reasons behind the anxiety if found, and the reason for rejecting the vaccine, if any. The survey will also seek to identify and extend the public awareness on the pandemic, its symptoms, modes of transmission, proper treatment when infected, and the most vulnerable people infected, in addition to identifying the sources of his or her knowledge about the vaccine. Now, the key developments in the preparation for implementation of the compulsory health insurance scheme in the Sultanate for the employees of the private sector and visitors, Damani, were discussed on Wednesday. The health insurance team and members of the team representing the concerned entities took part in the 11th meeting, chaired by Ahmed Ali Al-Mamari, Vice President of Insurance Sector. The meeting reviewed the execution of works and projects relevant to the implementation of the scheme. The chairman of the health insurance work team said that the Dhamini scheme is one of the leading projects in the Sultanate and would contribute to achieving the national priorities of Oman Vision 2040. It would be an economic and social addition to the country to enhance the partnership between the public and private sectors, in addition to its role in promoting the work environment in the private sector through adding employment benefits and providing healthcare for the employees of the private sector. Also, in continuing with that, furnishing safe health environment for the visitors by providing treatment services according to new financing options that would alleviate the burden on the general budget of the state. It's time for a quick commercial break, but stay tuned as we have more updates coming your way from our international desk.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Welcome back to TTV. You're watching Midday Update. Continuing the rest of the stories from our international desk. Kuwait will launch the COVID-19 vaccination campaign today with the elderly and first frontline workers receiving the jab, Kuwait's Minister of Health Basil Al-Sabah said yesterday. During an inspection of the vaccination center in Hawali Governorate, the minister said that the vaccine would arrive on a monthly basis in Kuwait for a period of a year, affirming that the ministry was keen on delivering the vaccine to people nationwide. The minister thanked the medical cadres, technicians, and experts for their around-the-clock efforts in the previous months, saying that it resulted in the logistical success of delivering the vaccine to Kuwait. Kuwait will also now begin a new phase of vaccination and hopefully beating the virus, he said, adding that it was important to eradicate the COVID-19 rather than focus on bringing the number of infections down. Herd immunity could only be achieved through the vaccination campaign, he said. Kuwait received on Wednesday the first shipment of coronavirus vaccines, the country's Ministry of Health announced in a statement. The recovery rate of COVID-19 patients in India on Wednesday increased to 95.68%, the country's Federal Health Ministry said. Till now, 9,663,382 patients have been cured and 289,240 patients are under active medical supervision, the ministry said. According to the Federal Health Ministry, the constant increase in recoveries has ensured the reduction in actual caseload, and currently the total positive cases in the country are 2.86%. During the last 24 hours, 23,950 new positive cases were reported in India. While 23,950 people were found positive in the past 24 hours, India has registered 26,895 new recoveries during the same period. A net decline of 3,278 cases has not been recorded in the total active cases in the last 24 hours, the ministry said. It continued saying that 75.87% of the new recovered cases are observed to be concentrated in 10 states, including Kerala, Maharashtra, West Bengal, Chhattisgarh, Delhi, Uttar Pradesh, Gujarat, Rajasthan, Tamil Nadu, and Karnataka. Kerala has reported the maximum number of single-day recoveries with 5,057 newly recovered cases. 4,122 people recovered in Maharashtra in the past 24 hours, followed by 2,270 in West Bengal. Over 77% of the daily new cases are contributed by 10 states, including Kerala, Maharashtra, West Bengal, Chhattisgarh, Uttar Pradesh, Karnataka, Tamil Nadu, Madhya Pradesh, Gujarat, and Delhi. Kerala continues to report the highest daily new cases at 6,049. It is followed by Maharashtra and West Bengal with 3,106 and 1,653 new cases respectively, the ministry added. India has progressively maintained a low case fatality rate, which is known as CFR, compared to the global average. The national CFR has fallen to 1.45%. During the last 24 hours, 333 deaths were reported across the country, as Maharashtra saw the maximum casualties of 75. Health officials say the successful implementation of test, track, and treat strategy, along with timely and appropriate treatment, has led to the consistent slide in the fatality rate. According to the ministry, the number of recovered patients has overtaken active cases by more than 33 times. Health officials said newly daily cases continue to trend downwards, with people remaining vigilant and resorting to appropriate behavior of wearing masks and washing hands. It's time for a quick commercial break, but stay tuned for more
Oman's
updates from our
largest
sports
online
desk.
supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Welcome back to TTV. You're watching Midday Update. Now from a sports desk. Oman Sails 49er Olympic teams have resumed training and begun an intensive program to regain their physical fitness, sharpness on the water, and sense of teamwork in preparations for the Asian 49er Champions Qualifier event ahead of Tokyo 2021 Olympic Games. Rashid Al-Kindi, Oman Sail Director of Sailing, said, "The training camps are essential to the preparation of our 49er teams ahead of a busy schedule. We have been building towards the 2020 Olympic Games for 4 years and now have to assess where our sailors' level currently is and ensure they are ready for the final qualification event. The suspension of training due to COVID-19 has affected us all in many ways, but we are now so close to achieving Oman Sail's goal of competing for and winning a medal in sailing for our country. We have to do everything we can to ensure our sailors arrive at the competition in optimal condition." In addition to that, the team was recently visited by Sayyid Khalid Al Busaidi, who's the Oman Olympic Committee chairman, to show his support. Now, Qatar will host the FIFA Club World Cup 2020 from February 1st to 11, 2021, after it was postponed earlier this year due to the COVID-19 pandemic. 6 continental confederations, as well as the host Nations League champions, will compete in the tournament, which will be held across the FIFA World Cup Qatar 2022 stadiums, including Ahmed bin Ali, Khalifa International, and Education City. The Ahmed bin Ali Stadium, inaugurated just week on December 18, will stage the opening match between Qatari champions Al Duhail and Auckland City of New Zealand on February 1st, and the final will be played at Education City Stadium on February 11. Joining the two teams will be European champions and German side FC Bayern Munich, CONCACAF champions Tigers UANL from Mexico, Al Ahly SC Egyptian side, and winners of the CF Champions League, along with Ulsan Hyundai, who recently laid claim to the AFC Champions League at a match played in FIFA World Cup Qatar 2022 venue at Al Janoub Stadium. The winner of the Libertadores will determine the South American representative, rounding off this edition's participants. The South American title winner will be determined by the end of January 2021. The draw to finalize the detailed pairings in the tournament will take place in Zurich on January 19, 2021. With this news, we have come to the end of the episode for today. But stay tuned as we'll be back again next week at 2 p.m. with more news and updates your way. Keep watching TTV.
You've just heard the live feed from the TTV studios on TFM 95.4. Let's talk.